brings you to the office?
I have a pain. It starts from the lower back
Okay.
and it goes all the way down, like sciatica.
Okay.
And I can't sit.
So it's a shooting pain going down your leg.
Yeah.
It's starting in the center of the spine or at the
From the bottom of the hip, right
the
here.
bottom of the hamstring.
Yeah,
At the
yeah,
bottom.
yeah, yeah.
And it's coming down into the foot.
Go all the way at the bottom, yeah.
To the heel or
Yeah,
the foot?
right here, right
Okay,
here.
so it's
Yeah.
stopping at the heel
Yeah,
here.
right here somewhere.
Okay.
But this area always pain me. Give me. a
When
lot
did
of
it
pain.
start?
While I'm sleeping at the night and especially.
When?
Like
When? What day? What year? KSL.
This year, 2018, start in I think March.
Okay.
And
Did you have a slip, a fall, an accident?
No, I just was shoveling the snow, and the
Okay.
pain start from there.
So you were shoveling
I
the
was
snow,
shoveling.
bending,
Yeah.
twisting this way,
Bending,
to the
twisting.
left or
Yeah.
to the right?
Right, left, both sides.
So, but majority is what? This
yeah,
way or
yeah,
this way?
Mostly like on the right side.
On the right
On the
side.
right-
So
yeah,
you're
because I'm
going
a right
bending
hand.
forward and you're going to
yeah,
the right.
Yeah.
Okay, so you're shoveling snow where? We don't have snow in LA.
No, but in Canada,
Okay,
Toronto.
so you're coming from Canada.
I'm in Brampton City. Yeah.
Okay, TK. So you're shoveling snow
Yeah.
and you felt the pinch right away.
Yeah. No, I feel the lower back pain first.
Okay.
For 1 week.
Okay.
I thought it might just ignore it. It will go away. It just
Okay.
may be cold. Maybe the muscle got pulled over, but it will go away. But no, I didn't make mistake. But after 2-3 weeks, the lower back, the hip, the sciatica thing
You
happened.
started getting pain down your leg.
Yeah.
Okay, I
Yeah.
got it. And what did you do for it?
I thought then I wouldn't able to walk or wouldn't able to sleep or anything like that. My family suggested me go to chiropractor first,
Okay.
and they are really good with this part and stuff.
So you
But
went to a
I
chiropractor.
I went and they were taking also long, but during that process with the chiropractor, I also went to the hospital as well.
Okay.
So they did my X-ray and everything, and then I'm
And they did an MRI.
MIR as well.
Okay, and they found that you have a disc protrusion or a
Protrusion.
herniated disc at L5S1,
yeah.
right?
Yeah.
Okay. And so from the time you went to a chiropractor,
Yeah,
you also got some treatment at the hospital?
hospital, yeah.
What
But
did
they
you
gave
have
me painkiller injection, but
Painkiller.
it worked only for maybe couple of hours, and that day I slept really good just
Okay.
because of the pain was gone.
Okay. So they gave some good painkillers
Yeah.
right, to go to sleep. Okay, so at least you slept one night.
Yeah, one night.
Since then, have you been able to sleep properly?
Not really.
Okay, how is it affecting your life, your quality of life, your work?
Badly. I can't work, I can't sit to sleep or anything like that. Like it
Okay.
really affect me really based on regular life I had before.
Okay,
It affect me so badly.
are you working right now?
No, I've been now working almost 2 months. now.
Family?
I have family, yeah.
Okay, and, okay. So you came a little bit of a ways to
Yeah.
try to get this resolved.
Yeah.
So let's see if we can't figure this out, but before, you had treatment, so you had a painkiller shot done at the
Yeah.
hospital, it lasted
Yeah.
a few hours.
Yeah, a few
That
hours.
was it. Then you
Just
had some
temporary.
you had chiropractic work done?
Yeah.
They told you what the issue was?
Yeah, they told me everything. They made my profile and everything.
Okay.
But the result I was getting was not happy.
Was there any result?
No.
Okay, so were you getting adjusted?
Not just, he was just doing stretching every day. So because I was in the pain, so he thought if I do fast, it might affect you in the back and everything.
Okay, so
But-
basically he came with a report of findings, a big nice stack report to compare all his stuff, and he does have what it says is L5S1. The question is it coming from L5 or is it coming from the sacrum? Now, we had you take some standing x-rays, which I don't have to show the x-rays, but I'm going to talk about what we see there right now.
Okay.
I'll show you the x-rays
Okay.
in terms of what's going on. Okay. So the report, you went through this, it's a fancy report that, compares normals and your x-ray and all this stuff, and there is things going on, but I'm wondering why you went 12 visits.
Almost.
Let's say 10 visits.
Yeah, 8 to 10 visits.
Okay,
yeah.
8 to 10 visits, you went and there was no adjustment given
No
to you.
adjustment, yeah.
So, the reason we have chiropractors.
He was just with the plastic gun he was just do like that.
Okay, so
Yeah,
he
I
was
don't-
using some device.
Yeah,
And
yeah.
stimulating something in your
Yeah,
spine.
but didn't work out anything.
Fair enough.
Because I have stress in the back as well. But sometimes when I move my shoulder like this side, if I force it, then I go like that. Otherwise, if I don't force it, I just do like this.
Okay.
Yeah.
So we have a neck issue, but you're here for your back.
Yeah.
I'm
both.
gonna check your whole spine regardless.
Okay.
Okay?
Okay.
What else do I need to know? Any other slips, falls? Were there any
No.
other traumas?
No.
This was a shoveling snow accident.
Yeah, that's it. Yeah.
Yeah. And with that, you're doing this, so it affects the neck also.
Maybe. Yeah.
Did you
maybe.
feel anything in the neck
I just feel it's very heavy stress. And
after this?
After this, yeah.
But
Before
before that?
was okay.
So it looks like neck and back affecting this shooting pain down your leg.
Yeah.
So it could also be coming from the neck. Who knows? Let's see what we find.
Okay.
Okay?
Okay.
I've been that patient where it was here causing my sciatica.
I see.
So let's see what we find.
Okay, sir.
Okay, and then let's go forward from there. Let me see you walk, please. Straight line. So you're walking funny. Why are you walking like that?
Because this leg give me pain when I pick it up.
When you pick it up, there's
Yeah.
pain. Not
Yeah.
not when you step down.
When I step down, there's a like tickling side, like this.
On the heel.
Yeah, on the heel right
Take
here.
it. Okay.
So
Keep walking.
दोनों तरफ, yeah.
I understand if you speak in your
Yeah.
local language. It's okay.
But at the daytime, sometimes I walk so good, but at the nighttime and in the morning, my pain comes back and I have to walk like this. Like, ek टांग उठा के, एक
Yeah.
टांग नीचे, that's it.
So there's two things going on. One is he's walking like it's the disc or the spine, but it's also looking like the pelvis. Okay, just from the walk. Keep walking. And just normal walk. This. Turn, keep walking. How was your plane ride over here?
Sitting problem.
So you walked around in the plane?
Yeah.
Okay. Come over here and have a seat. So let's see what we find here.
Okay.
Temperature. Look straight ahead. Now, just looking at him, the first thing, look straight ahead. You can see that the right ear is higher and it's turned this way. It's almost like that atlas, that upper cervical has gone anterior. Because when we look here, this looks straight, and then right from here, right here, it's turning. When we're looking at the low back, okay, it's kind of straight in through here, like the muscles are guarding. And first thing I want to do is just check and feel the pelvis, okay?
Yeah.
Just in here. Pain in there?
Yeah, yeah.
Okay.
It goes all the way down.
More at the bottom?
Yeah, like here, yeah.
How about the top?
Yeah, right here as well.
So the whole joint you're feeling?
Yeah, for sure, yeah.
Watching him walk, it looks like there's something going on with the pelvis and potentially the sacrum. He did have an MRI report done, and the issue I have with non-weight-bearing MRIs is, at least the ones I've seen, and compared to the x-ray, it's always been off. 99% of them were off by one segment. And when I'm talking about fresh injuries, when we're talking about degeneration, that's not going to change from seated, standing to lying down. I do prefer, and we use non-weight-bearing MRI, weight-bearing. I prefer using weight-bearing MRIs. So we have a place that does seated MRIs here, and it gives us a more accurate depiction of what's going on with the disc. So we have a reading at the upper cervical, okay, on the left. 15 points. It doesn't mean the pressure is there, it just means there's a difference between left and right side. As we run the meter down the spine, not a lot of action there until we get here. And then as soon as we get here, it starts to go left. But it's not a huge reading. It's almost like 8-9 points. Okay? Let's put the thermocouples closer together and see if something changes. It's about 10 points. Yep. So we're getting a 10-point break on the left side. We're getting two majors, sir.
Okay.
Okay, we're getting bottom left, SI joint, sacrum, and we're getting the top left in terms of the atlas. Next thing we're going to do is static palpation, and I'm just feeling down the spine, okay?
Mm-hmm.
And as I'm running my fingers down the spine, that actually feels pretty good. Round your back for me, please. Shoveling snow. That's how you did this, huh?
Yeah, it was really cold as well.
So who's shoveling the snow now?
Oh, well, we...
That's the question. Scoot forward. Put your feet together and open and close your knees. Like
Okay.
a butterfly back.
Okay.
Open and close. Let's check his pelvis out.
Start.
Open, close. Open, close. Open, close. Do your right side only. So this whole thing is shifting, okay? You can see the whole left side is shifting. Do the left side only. Not so bad. This is left pelvis, okay? Primary. Let's check the glutes. Right, left side is higher. Just a little bit flatter. Looks like ASIN. Anterior superior has gone up and slightly in, okay? Now, we have to determine if we're doing the pelvis or the sacrum. And in the work that we do, there's a way to determine it. You're fine right now. Come back over here. So when we have a pelvis issue and a sacrum, have a seat slowly, please. We need to figure out which one. Now, we know the left SI joint is what's causing all of this, and we know there's also an upper cervical we're going to deal with. So what we need to figure out is, let me check the joint. Top, middle, bottom. Top, middle. The bottom is the worst.
Yeah.
The AS pelvis causes the pain and swelling on the bottom of the joint. Okay, now let's go to the sacrum, S1. That's L5. How's L5?
It's a little bit pain.
More than the SI
No,
joint?
less than that.
This is more here,
Yeah,
correct?
this is more, yeah.
L5, S1. How's that one?
Yeah, just a little bit pain.
Not as much as the pelvis.
Yeah.
The pelvis is more?
Yeah.
Got it. We saw left ASIN pelvis. We know there's an upper cervical issue as well. Let's go ahead and just motion the neck. 7, 6, 5, 4, 2. Bend left, bend right. Head down, turn left, turn right. Doesn't want to go as well to the right. Correct?
Yeah.
Right there. We have an ASR atlas on the film and it matches the patient. We have a left ASIN and a potential rotated sacrum. We're going to do a leg check, and we know that there's a leg length discrepancy, but now we need to see, and we may actually need to give you a heel lift also, okay? I'm going to explain that later. That's not from the shoveling of the snow. If we look at his heels here, check it out. His heels are off quite a bit, right? You can see this one. There's almost a finger difference. So I'm going to bend his knees. If the left side stays longer, we're going to do the pelvis. If the left side goes shorter, we're going to do the sacrum. Still stays longer, even though there's a good change. Let's try that again. You okay, sir?
Yep.
Yeah. Does that hurt your back when I do that?
Yeah, right here.
On the hamstring?
Yeah.
Okay. You okay there?
Yeah, I'm okay.
Let's do it quick, okay?
Okay.
Oh no. So just from that,
But I still feel pain while I pick up the left leg, like before.
any difference?
Thoda. But I still can feel the same pain that I had the first
Okay.
time.
No problem. Let's go face down. He's walking a little different.
There's no
There's no
limp.
limp.
You had
Even though-
limp before, remember, like that?
Walk.
It's no more like your whole
Yeah,
walk
because
changes.
different night time, different morning time, different.
No, right now, when
Walk.
like just
Yeah, walking is a different, but the pain is still there. You know, while जब मैं इसको उठाता हूँ तो मुझे pain होता है.
All right, let's see.
because he didn't see his back, you know.
Look at the
See.
legs now. I didn't even touch. Look at that.
Oh yeah, there's like the offset is
You see
It's-
that?
is gone, almost.
Still the pelvis. You okay with that?
Yeah.
You sure?
Yeah.
What are you thinking about right now? Huh?
Thinking about his wife.
You got a baby on the way, don't you?
Yeah.
Yeah.
Well, we gotta get you better for the baby, don't we?
For sure.
You gotta change diapers, don't you? You wait. It's 80 diapers a week, dude. 120 diapers a week. I got a 2.5-year-old, I know. It's a lot of diapers, yo. I thought people were joking when they said it's 80 to 120. Aram se. Come on. It's already starting to go.
That's why I'm never gonna marry.
Don't say that. Ah, relax there, please. Nice and easy. You gotta let this go.
Huh?
Home run!
Damn it,
You're
that's
okay,
it.
sir. Chaka chaka chaka!
I can feel the pain over here. That's it.
Oh, that's cause.
Just walk. He's not limping anymore.
Oh, definitely not.
So the idea is what first, right? We gotta get the pressure off. It's like this. Think of it this way. You keep walking as I'm talking, all right?
Okay.
But I want you to think of it this way. Let's say you drop a big rock on your foot, right? It hurts.
Mm-hmm.
You gotta take the rock off.
Mm-hmm.
It still hurts.
Yeah.
But we gotta get the pressure off. Look at how he's walking.
Yeah, no, I don't feel the pain. But जब मैं चलता हूँ और only feel pain wherever you just.
How about when
whatever you just did.
raise this left leg?
Oh, amazing.
Raise the right leg. ठीक? आस्ते बाबा, आस्ते.
No.
You got a little too excited right there.
Don't get too excited. Walk it out. No, get too excited, but don't overdo it.
Okay.
So yeah, so the trip was worth it, huh?
Was the trip worth it?
Yeah.
All the way from Brampton to Rana.
Brampton, boy.
Okay.
Open and close your legs, please. Make sure your feet are touching. Look at my fingers, sir.
Yeah.
Right side only.
So
Look.
first thing was one side was coming out. I remember that.
Left side
Not
only.
anymore.
They're moving independently.
But while I was doing right side, it was pain over here.
So first thing is, neck is clear. That wasn't a break, but a flutter. He's clear. Now, listen, I need you to understand something, okay? We got to the cause of what's going on. It was your atlas and your left pelvis.
Okay.
Whatever's going on in your reports and this and that, I'm not gonna get into false positives, but there's false positives that happen on non-weight bearing MRIs. Whatever it is, it is.
Mm-hmm.
You're gonna have a little soreness, and you're gonna go through this over the next day or two. You're gonna see as the days go. Okay,
Yeah.
it's fine.
Yeah.
But we got to the cause, we got it adjusted, now we move forward.
Okay.
Okay? Now, when I ask you next, you're gonna have it. Now,
Okay.
what's the body gonna wanna do? It's gonna wanna try to stabilize it. You put heat on it, it's gonna get worse.
Okay.
You put ice.
No hard work.
No.
And then, should he sleep on the mattress or the hard floor?
Try if it's a firm mattress is fine. Sleep on the back, put 2 pillows under your knees, put
Okay.
1 pillow under your neck, or sleep on your side, not on this side, not on your left, on your right.
That right
And
side.
put a pillow between your knees. That's the most important thing, don't let the knees touch.
Doesn't matter what position I sleep, I have to put the pillow in the leg.
Either between the knees on your side or underneath the knees.
Okay.
Okay.
So while I sleeping straight, I will put underneath.
Correct,
And
2.
when I sleep right side, I will put
One.
between. Yeah.
Between, yes. You will ice here, you will
Okay.
ice here. You will
Okay.
do that for 20 minutes.
Okay.
You will wait an hour, you'll do it again, you'll keep going.
Okay.
Okay, you just, as much as you can, the ice.
Okay.
Also the walking. If you're gonna be in traffic for 2 hours, I'm gonna give you the pillow that I use to prevent that from going stagnant, okay?
Okay.
If you're in the car more than 40 minutes, just pull over and get out.
Gotcha.
Okay, get out, pull over, get out, walk a little bit. You can't sit in a car for 2 hours.
I see.
Not right now.
I see.
Okay?
Okay.
And you're not in a rush.
No, definitely
It
not.
is
Yeah,
what
no.
it is. You can walk along the boulevard, maybe get a juice or a smoothie or something to eat or
For
whatever
sure.
you want.
For sure.
If you like, or wait till you get back. Whatever is.
According to your report, there's no effect on my discs.
On your what?
Disc.
Your disc.
Yeah.
Your L5 disc on your X-ray, and what I'm finding sacrum. It said L5S1.
Yeah.
S1 can affect the L5 disc. L5 could affect that as well.
see.
So it's the sacrum that I found along with the pelvis.
Right.
But from what we did just now, it was the pelvis that was the cause, that's where we had to start. But that started up here at the atlas.
I see.
That's
Just because of the snow, yeah. Yeah.
okay, so something went out here that started to affect the messages going down your body.
Right, right.
So it was blocked here, it was blocked here, it was blocked here.
I see.
Okay?
I see.
Let's see what happens.
Okay, thank you so much, doctor.
Welcome to the office.